like in the scenarios with a lot of autistic children, we have application that goes on the back side of the brain and the front side of the brain if challenges are associated with social behaviors or in general speech, delayed development, things like that. Same concept, we get to close our eyes and we apply on the forehead, right? So same process, 5 seconds on, 30 seconds off, and the kid or the patient gets to play and do whatever else they need to do for the next 22 seconds. So the process is very timed. Like I said, it's tailored to each patient. Every 2 weeks we get to repeat the EEG so we can see how we're making progress. If we are making progress during those EEG consultations with Dr. Vo is when you get to hear whether or not we need to increase the intensity. Pardon me. Again, 5 seconds on, eyes closed, and 1, 2, 3, 4, 5. Good job. So yes, those consultations is where we get to determine whether or not we can or need to increase the intensity of the magnetic waves that are coming through. We also get to determine if maybe we need to have a location change that happens too, right? Motor thresholds get to be retested periodically as well for that same reason. Just because as we start the stimulation of the brain starts becoming more and more acclimated to the process. So you want to start making sure we kind of work along the way with the tolerance and also work along with patient that is able to maybe take on more or less. And I've had so many patients that were asking me, or so many parents that were asking me, how do I know how many locations I will need? We don't know. What we do know is we start the EEG, we get the assessment done, we determine which part of the brain needs to have a bit of a stimulation to kind of kickstart it in the right gear, and then we get to start the treatment, and then we periodically monitor every 2 weeks. 1, 2, 3, 4,